Calcification, doctor, pathological calcification is a favorite topic. You have two kinds, dystrophic, metastatic. Whenever there is a degenerated dying tissue into that calcification occur is called dystrophic. In these people, if you look at calcium levels, they are normal serum calcium levels. Metastatic means even in normal tissues when there is a hypercalcemia, there is a deposition. So their calcium levels of metastatic are typically high. So in the areas where they are necrosed are the classical locations for the dystrophic calcification. So whenever there is any advanced atherosclerosis, as what you can see these are all the calcific plaques. Nowadays we are all in the days of very high resolution of CT scan. So one point of time will come where CT can be able to diagnose without the need of any coronary angiogram. Already those days have started. So calcification is dystrophic calcification in these people. Even tuberculous lymph node can become stony hard because of the calcification. This is another example in the stomach. The degenerated part of the gastritic area is showing the signs of calcification. Histologically, if you stain, how will calcium look like? On hematoxylin eosin, they have a basophilic, amorphous, granular and clumped appearance is a classical description on a hematoxylin eosin stain for the calcification. This can be intracellular, extracellular, any of the areas, and samum bodies are another example we need to talk when we say dystrophic calcification are the examples. What is samum bodies? You have lamellated configured structures which resemble the grains of the sand which are found in papillary cancers. It can be papillary thyroid cancer, it can be meningioma in any of these entities. Then sometimes there can be calcium and iron salt along with asbestosis. Asbestos can show the deposition in the form of dumbbell shaped forms. Calcific deposits is what you see in the case of the asbestosis. Is what you need to remember. Then metastatic, when hypercalcemia is there. Obviously all causes which lead to hypercalcemia. What are the four major causes that you will remember reflexly when we say hypercalcemia? Hyperparathyroidism due to parathyroid tumor or any PTH related protein produced by the malignant tumors. Any destruction of bone tissue, like in case of the multiple myeloma or leukemia. In multiple myeloma you have an osteoclast activating factor, OAF release, that destroys the bone, releases the calcium leading to hypercalcemia. Then any diffuse skeletal metastasis like breast cancer can destroy the bone and release the calcium leading to hypercalcemia. Or a Paget's disease like condition, there can be accelerated bone turnover or any prolonged immobilization. Any of them can lead to the development of hypercalcemia and metastatic calcification. Any vitamin D related disorders like vitamin D intoxication. Similarly, why in sarcoidosis there is hypercalcemia, doctor? Sarcoidosis is a granulomatous infection. Not infection, granulomatous state. Non-caseating granulomas are there. Granulomas contain macrophages. Macrophages will be producing a vitamin D precursor, secreting a vitamin D precursor, which lead to increased calcium absorption leading to hypercalcemia in case of sarcoidosis is what need to be remembered. Then entities like Williams syndrome, you should not forget. Idiopathic hypercalcemia of infancy it is called as. They will also show the presence of metastatic calcification. Then in renal failure, there is a hyperphosphatemic state. Hyperphosphatemia stimulates the parathyroid to produce excess parathormone. That excess parathormone dissolve the bone and release the calcium, and that will try to increase the calcium levels. Any of them can be the predisposing factors. Then aluminum intoxication. which occurs in, aluminum intoxication should be remembered. Then any patient on chronic renal dialysis will typically show the aluminum, earlier dialysates used to have more of aluminum. Then milk alkali syndrome. Those who earlier days before the discovery of pantoprazole, omeprazole, who is the ruler? Above 40, if you eat a little wedding dinner, the entire night you need to keep drinking milk of magnesia and all antacids which are all available. So that used to lead to milk alkali syndrome with hypercalcemia. Now doctor, what are those tissues typically metastatic calcification will go and deposit? That means hypercalcemia is there. Tissues are normal. Into that deposition is occurring. Which tissues are highly vulnerable? Gastric mucosa. We have seen earlier gastric mucosa. Then kidneys, nephrocalcinosis can occur if in hypercalcemic state. Lungs, as what you can see, the calcium can deposit in the lungs also. Then systemic arteries and pulmonary veins, even though there is no degeneration in them, calcium can deposit in metastatic calcification. I am not talking about dystrophic. Then that is all the story about dystrophic and metastatic calcification.